Let's talk a little bit about fevers as an immune response. First, maybe why fevers are actually a great thing, that we don't want to kibosh them. We don't want to quash them. So what is a fever? Talking about immune response, what is a fever doing in the body?
Yeah. Well, fever is really one of the things that as parents and as practitioners, there are a lot of misunderstandings, a lot of myths around, what fever is and should we treat it or not. And that's something that the conventional medicine model has done to us as practitioners and parents. I mean, when I think back to my days in the ER, when a kid came in with a fever and the triage nurse taking the temperature, taking some of the history, and then sending the kid out to the waiting room, before any doctor laid eyes on that kid, the nurse would give that kid a dose of Tylenol, right? That's just standard operating procedure, right? And it still happens to this day, even though we should understand that fever is our body's natural immune and inflammatory response to helping fight whatever infection's going on. In this case, we actually want that inflammation, right? I mean, a lot of people think of inflammation as always bad. We don't want any inflammation. It's a fine balance. We need inflammation. Just like, you have your child skins their knee and it gets red and maybe a little pussy, that little yellow film on it. Well, that is inflammation, bringing all of those white blood cells to the area to prevent infection and to help heal the skin. If that didn't happen, that your child's skin knee could quickly become an infection that took over very rapidly. And so we want inflammation, but we also want inflammation when it's done its job to go back down to normal levels, right? That's what doesn't happen for a lot of chronic diseases. We just keep inflammation up. Now, with fever, your body heating up is a way for you to slow down, right? Which is really important when you're sick. There literally is something called sickness behavior that we see in animals, right? We might see it a little more in men than women, right? but we do have this.
The man cold. This is the man cold that you're talking about.
But there is something to that. When we are sick, everything slows down in an effort to preserve our energy to fight the infection. And we're not meant to eat normally or play normally or use our energy in a normal way. We're meant to slow down. So for parents who come and they say, well, they're so tired, they're just laying on the couch being couch potatoes, I'm like, good. That's okay. Because some parents will come and say, well, when I give them the Tylenol, they're acting normal. They're jumping on the trampoline and it's great. I'm like, no. But now you're tricking your child's body and they're using even more energy. And then, of course, the fever is going to come back because we haven't dealt with any of the underlying infection and trying to help their immune system work in the way it should. Fever and heat also slows down organisms. It slows down the viruses or the bacteria so that your immune cells can go and attack them more effectively. So there's a lot of benefits for fever. And in fact, what some of the studies have found is artificially reducing fever with a medicine like acetaminophen, which is Tylenol, or ibuprofen, which is Advil. Or Motrin, right? Mm-hmm. Artificially suppressing the fever can actually make you sicker for longer. They've seen this in kids with viral infections. In fact, they looked at chickenpox and found that the duration was longer. And some studies have even found that it increases the viral shedding from your nose. So it makes you sicker for longer and makes you more contagious, which is absolutely what we don't want especially when it comes to our children, right?
What is too high of a fever? So I feel blessed in a way that I was always taught, even through my schooling, that antipyretics, like we should avoid them as much as we can. So the, like the fever medications. And I've always been very comfortable navigating a fever up to like 104 Fahrenheit. And I remember saying this to, I can't remember if it was a family member or a friend. It was years ago when my children were younger and they're like 104, I think that translates to like 38, maybe 39 centigrade.
Yeah.
And it was like, no, they're going to get seizures. Like they're going to get seizures at that
Yeah.
level. I'm like, no,
Yeah.
they're not. They're just like 104 is that's sort of my upper limit. And I think the highest my kids have had 104 before, but it's like cold compresses, popsicles, as I mentioned, just like rest, soup, bone broth, and it's,
Yeah. Yeah.
yeah.
What's fascinating is, when I was doing research for the book, I was looking to see what are the guidelines in other countries, right? And it varies so widely. And, when we think about what fever is too high and we're thinking about, can a really high fever cause brain damage? Can it cause febrile seizures?
Yeah.
Well, we have to look and see you can have hyperthermia where your temperature goes up, 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 up without a release and, can cause damage. Now, what's that number? It has to be at least over 107.6, which
Oh, Lord.
right.
God.
Yes. Now, if your child has a fever and they are not completely bundled up, right, so that they can't sweat, and they're not drinking and they're dehydrated, well, potentially that could go. But in a normal immune response, your temperature is not going to go that high. And so we really don't have to worry about that. Children tend to run a lot hotter. I mean, like my daughter, she'll run, she hardly gets sick anymore, but when she was little, she would be 104.5 routinely.
Yeah.
Right. I even saw one time 105.5, and that did make me hold my breath a little bit. Like I do want you as a parent to call me and say, hey, this is what's going on. But then you always look at your child. And so, I mean, Kenzie would just be sitting there. Her cheeks were bright, flushed red, which is how I knew she had a fever. But she'd be playing with her toys and like hanging out and like, chatting with me. And like, So it would be a total shock. Right. Whereas, Bodhi would have like 100.8, right? And he's laying on the couch like it's the end of the world, right?
Yeah.
And so fever really, really in a normal brain that is not over bundled, not in, like a steaming hot sauna or an environment where you're not able to sweat it out, right? Fever will not get to the point where it causes brain damage. Now, seizures, that's a different story too. A lot of parents and practitioners are of the mindset that if the fever goes too high, it could cause a seizure. And my twin sister had febrile seizures when she was a baby. We treated things very differently back then. She was actually put on seizure medicines, which we don't do anymore. And my nephew had febrile seizures. So it can run in the family, and they're so frightening when that happens.
Yeah.
They're not uncommon, right? So it does happen. But simple febrile seizures where the fever goes up and your child has a seizure lasting less than 15 minutes, whole body shaking, does not go on to become a seizure disorder or epilepsy or cause brain damage. Right. Now, when it's happening, it is really frightening. But here's the thing. I remember when I was first in training, we were instructed, to tell patients if you, in order to prevent febrile seizures, you want to alternate Motrin and Tylenol around the clock. So every 4 hours for the Tylenol and then every 8 hours for the Motrin and just around the clock to keep the fever from getting high enough that's going to cause febrile seizures. There have been several meta-analyses through the Cochrane database showing that this is not effective. If your child has had a febrile seizure, they may have another one, right? But giving Tylenol and Motrin around the clock does not help prevent a febrile seizure with the next fever unless, okay, here's the big caveat, unless they already had a febrile seizure in that fever episode. So the evidence now, and in this one Cochrane study, the latest one, the researchers who did this meta-analysis note that there's really no place for using fever reducers simply to bring down the fever. That the goal is, if our children are basically for comfort, right? If that is one of the goals, but bringing down the fever itself should not be the goal because it doesn't have the effect that we want it to and could have a negative impact also on your child's illness duration.
Yeah. And so I'm thinking about, this is sort of not exactly the same, but it's a parallel when we would have concussed patients in the clinic and we were worried about the brain, like chronic inflammation in the brain. One of the things would be either to do, we were taught, Tylenol, or to try and cool down the brain in some way. Yeah. So that might be a cold plunge, up to the neck. So like the whole body is you're sort of cooling down the whole body. And then by extension, all the the vasculature that's going up into the brain will also be cooled because the blood is cool. As I'm saying this, I'm like, well, you're introducing the risk of water, but is cold plunging or something like that, maybe cold compresses, ice packs, maybe, is that if we're starting to see the fever in that 106, 107 Fahrenheit, is cooling the baby, cooling the child? Protocol, no studies, no evidence. What do we know about cooling?
Yeah. Well, okay. So if they're 106 or 107, that's not a normal fever response. So I want you to go get seen, right? Yeah. But if your child's 104, maybe even 105, again, as a pediatrician, I still want you to call me, but you can do lukewarm baths. I wouldn't do cold because that can start shivering, which can then increase your temperature. But if it's a lukewarm bath, that can be helpful. Putting a lukewarm or cool cloth on the belly to cool your core can be more effective than, or on the feet. There's the wet sock method, right?
The wet sock.
The wet sock method that actually can be very, very helpful. And this is where I don't want to leave parents hanging, right? Because then they're like, okay, my kid has a fever. They're miserable. Is there nothing I can do? And absolutely not. There's tons that we can do that won't suppress the fever, but will help your kids get comfortable, help lower their fever in a more natural way, help the body kind of literally, I kind of view it as compressing the time to wellness, right? So that Pelargonium pseudoides that I mentioned, the UMCA, that can help, right? So start that right away. If you're, if you use some acupressure points. There's one acupressure point called large intestine 4, which is at the base of your thumb and index finger, that little web space. You can massage that and hold that firmly. Put a drop of lavender essential oil, which has anti-inflammatory properties in it, and that can help bring the fever down. This point has actually been found in some studies to have antipyretic, so fever-lowering properties. You can use, if they're over 2, you can go ahead and use a little peppermint essential oil. You just want to be mindful with the essential oils that you're using the right dilutions if you're going to be diffusing them. And so I give instructions on, you can look up dilutions, how to dilute, but you can look also in the appendix in the book. I have that resource for you. And then, homeopathically, do the oscillococcinum. Remember, the homeopathy really does need to be individualized. So just like we've given examples of our kids with very different fever responses, right? So, let's say for a kiddo who has a sudden really high fever and, they're glassy-eyed and they're kind of sweaty and they're red in the face, well, that homeopathic medicine that would help them is homeopathic belladonna. If it's more like a low-grade simmering, they're just kind of hovering around 101, and nothing too specific, then you might do something called ferrum phosphoricum. If they're really achy, chilled, shivery, and, really restless and they have a high fever, that would be Rhus toxicodendron. So these are all weird sounding names if you're not used to homeopathy. But once you kind of get your homeopathy toolkit under your belt, it becomes really easy to know, okay, this one, my child, when she gets a fever that's more like belladonna, as opposed to my son, I'm just going to keep the ferrum phosphoricum on hand because that's the one that helps him.
Yeah. And explain the wet sock method. Just, I know we brushed over it, but do you use the wet sock method, recommend it for your patients?
I don't use it that often, but I have pediatrician friends who do, right? Yeah. Where basically you're putting, wet socks on the feet and then warm wool socks over and then just letting that cool naturally. But it tends to, it'll cool down your feet and somehow, cool your body down. And I have pediatrician friends who swear by it. And so,
yeah. And sometimes you can rub things on the feet too. Like you can rub depending on the age of the patient, you can do the peppermint or the eucalyptus or something like that on the feet as well. Yeah.
Absolutely. The feet has all of those acupressure points too. So it's kind of like a little microcosm of your body. So you can absolutely do that. I also recognize that there is a time and a place for fever reducers, right? And so it's not like it's a never ever. But the times that I consider giving my kids, my patients or my kids a fever reducer is, two main reasons. If they're so uncomfortable that they don't want to drink anything, and because dehydration
Right.
will
Dehydration.
exacerbate the fever, they need to be
Yeah.
hydrated to
Yeah.
heal. And so I'll give them a fever reducer just to help them be comfortable enough to drink. Or if they're so uncomfortable that they can't sleep, because we know how healing and restorative sleep is. So those are the times. But the goal isn't necessarily to bring the temperature down to kind of stone cold normal. It can be just to bring it down a hair just so that they're comfortable enough to sleep or to drink and stay hydrated and just be more comfortable. And, then the question is always, okay, which one, right? Because there's the Tylenol and then there's the ibuprofen. And I used to say I always prefer the ibuprofen because acetaminophen will deplete levels of our master antioxidant glutathione, which is really important also to help fight our infections and help us recover faster, right? So if we're going to give Tylenol, then I usually also recommend doing Epsom salt baths to increase your glutathione levels, which your kids might really feel good anyway in a nice lukewarm bath. And also consider taking an extra glutathione supplement while you're taking the acetaminophen. But then as I was doing more research for the book and recognizing that ibuprofen, because I would always say go to ibuprofen. Well, ibuprofen in some studies have been found to disrupt the microbiome as much as antibiotics. And so then I don't want the downstream effects of microbiome disruption from ibuprofen. So if we're doing ibuprofen, then I also support the gut, similar to how I would support a child on antibiotics so that their microbiome can recover after they're sick.
That's great.